liability protections for big corporations. That seems to be their #1 concern. Mr. President, or Madam President, more than 30 million Americans are now unemployed. More than 80,000 Americans have died. Just how many lost jobs, lost businesses, lost lives will it take before Senate Republicans begin to feel the urgency? Now, on another matter. Last week, Americans learned that the Trump White House had blocked release by the Center for Disease Control of a document that contained guidance for safely reopening up the country. According to media reports, this guidance was painstakingly prepared by the CDC to help the country determine when and how to begin easing social distancing without causing undue risk to public health, the reoccurrence of a second wave, and more infections and more deaths. The CDC guidance included detailed information and flowcharts to help guide states, local governments, businesses, schools, churches and religious institutions, and individuals as they consider these very challenging questions. Businesses want to know how and when to open. Citizens want to know how they should behave to protect themselves yet get the country open. The CDC guidance includes detailed information and flowcharts to help. Now, a version of this document appeared in the media, but we still don't have the official document as completed by the CDC. Of course, every American, regardless of where they live or what party they belong to, wants to get back to normal as quickly as possible. I know every member of the Senate wants that to happen as soon as it possibly can. I certainly do. But making the wrong decisions about when, where, and how fast to reopen could result in the loss of precious lives that could be otherwise saved and in the recurrence of a COVID second wave that, God forbid, could be worse than the first. In order to make these decisions widely, the country needs guidance of the nation's best medical and scientific experts. These literally are matters of life and of death. And that's exactly why the CDC prepared this guidance. But the White House has blocked the release of the CDC guidance, reportedly so the President and his political appointees can make changes to it. Now, as we all know, the President is not a doctor. The President is not a scientist. Many don't even believe he's a stable genius, like he thinks he is. It has become painfully clear over the last 2 months how unfamiliar he is with the disciplines of science and medicine. Anyone who would say, drink bleach, use bleach to protect yourself, is not much of a medical expert. So it's difficult, if not impossible, to imagine any legitimate constructive purpose in a desire by the President or his staff to edit the CDC's work. I wish President Trump and his aides could be trusted to tell the American people the truth about this public health crisis. I wish they could be trusted not to engage in political censorship of the medical and scientific judgments of our nation's foremost experts. But at this point in the crisis, after all the falsehoods, all the disinformation, all the transparent attempts at political spin, every American knows full well that the President and his staff simply cannot be trusted to tell the truth about the coronavirus. Just yesterday, the President claimed that COVID-19 cases are falling everywhere in America. But another report, also yet to be released by the President's own coronavirus task force, is said to show that its infection rates are spiking to new heights in a number of large and small communities around the country, places in Tennessee and Iowa, Texas and Kentucky. The point is that America needs and must have the candid guidance of our best scientists, unfiltered, unedited, uncensored by President Trump or his political minions. The CDC report on reopening the country is an important piece of that guidance. The Senate should unanimously support the uncensored release of that document, and therefore I will now offer a very simple and brief unanimous consent request, and I hope all senators will support it. So I ask unanimous consent the Senate proceed to the immediate consideration of Senate Resolution 572, expressing the sense of the Senate that the report of the Centers for Disease Control and Prevention, entitled, quote, Guidance for Implementing the Opening Up of America Again framework, be released immediately. I further ask that the resolution be agreed to, and that the motions to reconsider be considered, made, and laid upon the table with no intervening action or debate.
Is there objection?